Hello, and welcome to Riverside's Lung Cancer Awareness Month speaker series. Riverside is pleased to present a new community talk on a different lung cancer topic throughout November. Lung cancer is the second most common cancer in both men and women, not including skin cancer. More people die of lung cancer than of colon, breast, and prostate cancers combined. In today's talk, Dr. Mirza shares symptoms you should be aware of, helpful information on factors that place you at a higher risk, and information on early detection of lung cancer through life-saving low-dose CT screening. Dr. Mirza?
Today we'll be talking a little bit about the statistics and the basic risk factors and the importance of early detection of lung cancer. So lung cancer is actually the second most common type of cancer in both men and women, and it affects about 1 in 15 men during their lifetime. This is only second to prostate cancer in men, and in about 1 in 17 women during their lifetime will be affected by lung cancer. The most striking thing to me, however, is the fact that lung cancer is the leading cause of cancer-related death, including 25% of all cancer-related deaths out there. More people die of lung cancer than from colon cancer, breast cancer, and prostate cancer combined. So some of the symptoms, the red flag symptoms of lung cancer can include a cough, which is not getting any better. It's going on for weeks. If you're having any new shortness of breath, a chest pain, especially one which is stabbing in nature, or a sharp chest pain when you're taking a deep breath. If you're having any sort of blood in your cough, any change in your voice, hoarseness of your voice, recurrent infections, if you've had pneumonias again and again, which are not going away with the proper antibiotic treatment, or feeling tired and fatigued all the time, or weight loss for no good reason, are all alarm symptoms that you should talk to your primary care provider about to make sure that we don't have any worrisome underlying causes. However, the most scary part about lung cancer is that most of the times it doesn't show up, it doesn't present with any symptoms until it can be too late. The problem with lung cancer is you don't feel pain inside your lung tissue, and unlike your skin, you won't be able to see a lump or a bump or a scar somewhere. And by the time the lung cancer gives you symptoms such as shortness of breath or blood in your sputum, the lung cancer is what we call not localized anymore, and more than likely has spread at least to the surrounding structures, if not to distant organs as well. And this is what makes lung cancer so difficult to detect early on. And this is probably the reason why lung cancer kills so many people every year. Some of our statistics have shown that only about 18% lung cancers at diagnosis are what we call localized. And in about 80% of the people when we diagnose lung cancer, we're not talking about cure anymore. We're talking about palliation, we're talking about prolonging life, but our goal should be to try to detect lung cancer as early as we possibly can, and to try to minimize the risk factors which put you at risk of developing lung cancer. So having said that, some of the risk factors, and I'm sure most of you must have heard about smoking being heavily associated with increased risks of lung cancer, but the striking part is almost 80% or more of the lung cancers are probably related to smoking. Secondhand exposure to smoke can also put you at increased risk of lung cancer, and having family history of lung cancer or having emphysema or COPD also puts you at an increased risk. We also have to be mindful of some environmental factors, for example, exposure to radon gas or long-term exposure to asbestos. a lot of my patients ask me about how do we go about trying to detect lung cancer early on, and the safe and easy answer to that is the low dose screening CT scans that we offer. This is just a CT scan of the chest. Only it takes a few seconds for the entire scan, and they try to give you as little amount of radiation as possible, so that we can, put you through a test which is safe and convenient, and try to see if you have any evidence of early stage lung cancer. The American Lung Association estimates that if everybody out there who is eligible for a scan were to get one, we would potentially save about 48,000 lives. The people who qualify for low-dose screening CT scans are people who are not symptomatic. If you do have some of the symptoms that we talked about, then perhaps your physician may choose a different type of imaging modality or a different type of test. However, if you are at increased risk and are asymptomatic, maybe you should talk to your doctor about getting a low-dose screening CT scan. The current guidelines, as recommended by the US Preventative Task Force, recommended that anybody who is between ages of 50 years and 80 years old and has been smoking 1 pack per day for more than 20 years should be eligible for a low-dose screening CT scan. You would also qualify for a screening CT scan if you quit within the past 15 years. If you've quit more than 15 years ago, then we hope that the increased risk of lung cancer by that time should have gone down close to, if not all the way down to that of the general population. According to the American Cancer Society, over the past 5 years, we have made some improvements in the survival rates of lung cancer. As previously, we used to be at about 13% survival. Now we're up to 22.6%. However, as you can see, these numbers are still very poor, and we still have a long way to go to try to minimize lung cancer and the burden it has on our society. So some of the factors that help us reduce the mortality from lung cancer in the forefront is stopping smoking, okay? And the other thing is, with screening CT scans, with earlier detection of lung cancer, you always have a better chance towards going for a cure rather than just palliation or prolonging of life. With that being said, we are also in the day and age where newer treatment modalities are coming up. The diagnostic methods, for example, EBUS and navigational bronchoscopies, are becoming less and less invasive. They're becoming less risky. And some of the treatments, including stereotactic radiation, minimally invasive surgeries, and the newer immunotherapies and targeted therapies on top of the traditional chemotherapy and radiation therapy, are also helping us in our fight against lung cancer. However, the chances of survival are always better if we detect lung cancer earlier. And with lung cancer, we cannot always rely on symptoms, because in most of the cases, by the time somebody has had some symptoms, it may be too late to pursue a cure. With that being said, if you think that you're more than age 50 years and you have been smoking for more than 20 years, we strongly encourage that you talk to your healthcare provider about getting a low-dose screening CT scan. Our centers have safety measures in place to deal with the current situation of the pandemic, to make sure that you're safe and taken care of while you're getting the screening CT scans. We always encourage strongly to take strong steps to quit smoking. The interesting fact is the average person who successfully quit smoking has tried and failed approximately 14 times before they successfully quit. So if you've tried before and have not been successful so far, that's not a reason to give up. you keep trying and you talk to your healthcare provider, and sometimes your physician may be able to find the best answer to support you with replacement nicotine or with certain medications to try to see if we can get you to quit. If you have people around you who you think meet the criteria for screening CT scan, also encourage them to talk to their healthcare providers and encourage everybody around you to try to stop smoking. And that's all I have for today, and take care.
Thank you, Dr. Mirza, for providing this valuable information with us today. Riverside invites you to share this information with your family and friends. Together, the more we share awareness for risk factors for developing lung cancer, symptoms to not ignore, and the importance of early detection for those at high risk, the more lives we may impact. I hope everyone enjoyed today's presentation and invite you to new lung cancer awareness talks throughout November. To learn more about lung cancer screening and early detection, please visit us online at riversideonline.com/lung screening. Thank you.